The state of Oklahoma implemented Medicaid managed care in April 2024 to help improve access to health care among Medicaid recipients. Anticipating this change, the Oklahoma Primary Care Association and the Oklahoma Behavioral Health Association have been working together closely, building a new integrated health network as part of their participation in the Delta Center for a Thriving Safety Net.
I think as we have really aligned our clinically integrated network to include both FQHCs, CCBHCs, and substance abuse providers, et cetera, that OBHA and PCA are really in the work together.
It started off with only 5 participants. Lou Carmichael was one of the founding members, and they've grown that now to 19 health centers, and we have added 5 community behavioral health organizations in preparation for managed Medicaid, and that's one of the things that we're most excited about and most proud of, some of the work that we've been able to accomplish through our participation in the Delta Center.
The Delta Center was launched in 2018 with funding from the Robert Wood Johnson Foundation. JSI led a national Delta Center team, including strategic partners from the National Council for Mental Well-Being, the National Association of Community Health Centers, and the Center for Accelerating Care Transformation. The goal was to advance policy change at the state and national levels and practice change among community health centers and community-based behavioral health organizations. Grantees use their Delta Center funding to support a broad array of policy activities, including background research, education and training, stakeholder engagement and convening, and building shared policy agendas. The Delta Center helps seed relationships that bloomed over time into powerful collaborations. Through funding by state associations and other sources, those collaborations led to significant policy victories and practice changes.
And I think that the policy piece of it is that if we really stay at that higher ground of alignment and what's better for people and whole person care, then the primary care and community-based services are a natural alignment. And I think that the Delta Center has made the difference in that conversation.
Another area where they are combining forces is workforce recruitment and training.
As we are taking care of people, finding places where they can be retrained and become part of the allied health workforce, so that you have that peer support from person to person, the promotoro, if you would, or the health worker, or the peer support, lived experience. All of those things relate to respect of people and where they're coming from, and I think that's part of the story.
As the two associations and their clinical service providers work together, they're seeing how integrated care directly benefits patients. Sarah describes what happened after one of the health centers began doing regular social health screenings of patients.
Over 60% of their patients were worried about how they were going to feed their family that day. That was something that they had no idea about that before they did that work together. And as a result of that, they've been able to engage several different food pantries to bring resources into their combined space.
A lot of the work focuses on what's happening with the state associations, but we've also had national partners involved. And then we've also seen a lot of our state teams find opportunities to engage their member organizations and kind of build that shared understanding within the state as well. So I think of those 3 levels as a really powerful approach to engaging in collective action.
Really, that next step of making sure the systems work is the systems have to align, and they all have to include mental health, primary care. And so I think that is why the Delta Center work is so fundamentally important. We're a big part of the system now, and we need to be leading.